My name is Musa Dube from Botswana. I'm professor of the New Testament in the Department of Theology and Religious Studies. I've been there since 1988, and although I did some time with World Council of Churches as a theology and HIV/AIDS consultant, training church leaders and theological institutions on mainstreaming HIV/AIDS and gender in their curriculum. A lot of church leaders and theological lecturers had actually graduated before they learned anything about HIV/AIDS, and they found themselves in communities that were highly affected by HIV/AIDS, and they needed skills of responding constructively, whether it was preaching, whether it was counseling, whether it was liturgy, whether it was teaching. So we needed to follow people up, with workshops that will give them skills of serving in communities that were devastated by HIV. So we did this by holding workshops, 1 week workshop, a day to give people about facts, about HIV/AIDS, medical facts, and in their context, and then look at how do you mainstream HIV/AIDS in reading the Bible, for example. Like Old Testament, New Testament, how do you mainstream HIV/AIDS in interpretation of the Bible for prevention, for discouraging stigma and discrimination, for caregiving, for treatment. During those days, we didn't have much about treatment, I must say. And then how do you interpret the Bible to empower youth, women? The issues of gender and social justice were so important then, primarily because a lot of church leaders seemed to assume that the problem was primarily at immorality, whereas the problem was intertwined with structural immorality. In other words, if people lived in communities that did not empower them to make decisions about their lives and to be able to implement them, no matter how much you taught them about, abstinence, no matter how much you taught them about faithfulness, it did not protect them from HIV. So it was really important, to travel with church leaders, on understanding, communal morality, structural immorality, national morality, international morality. But I'm using that word really to talk about justice, so that members needed to live, in justice-loving communities that empower them to be able to make decisions about their lives. And then people can abstain and be able to protect themselves, or be faithful and be able to protect themselves, or you can give them a condom and they're able to use it. But if they don't have decision-making powers, you can teach them, they can know, you can even give them a condom, but that doesn't mean that they have the power to use the condom. So part of my training was to assist, the church leaders, to do a ministry that is conscious of such issues, to travel, with communities, to try and empower communities, to try and be, in their counseling, in their preaching, to be able to talk about gender equality as much as they can, So we would do theology in the HIV/AIDS context, reading the Bible in the HIV/AIDS context, counseling in the HIV/AIDS context. We'll also bring medical, doctors to give us facts, for church leaders to be able to understand some issues that may be beyond their theological understanding. Yeah. And lastly, we'd also do strategic planning and try to encourage, church leaders to adopt policies, and in theological colleges as well, to adopt policies, because really, if you don't have a policy, then you don't have a framework that empowers your members to act on the issue. Since I started this work back in 2000, I would say one of the major differences that we have seen now is that in terms of theological institutions, I could actually count a number of theological institutions that have started centers for theology and religion, or theology and HIV/AIDS. a number of theological institutions that have programs like Masters in Theological, Studies and HIV/AIDS. Some of them have studied even, masculinities. One of the things that definitely happened with HIV/AIDS is that it opened a space for discussions and for being self-aware about, various groups. So this has happened. We are now maybe a church that is more open to various sexual orientations. We are a church that is a little bit more conscious about gender disparities. We still have a lot of work to do, I must say. We are not, yet to the land of freedom, but at least the journey has started, and much more work still needs to be done.